Guys, welcome back to Medical Coding with Blue. Today's episode, I'm going to talk about medical coding manuals and what do they look like and what's going on with these. So here we go. All right. Now, if you are taking a outpatient medical coding certification exam, these are what your books can look like, okay? Because both associations do, the American Health Information Management Association and the American Academy of Professional Coders do require you to have this particular book. This is the AMA CPT Professional Edition, okay? You have to have this book, all right? And right now we're in April 2024, okay? So AHIMA will go into their 2024 tests beginning May 1st. That's when they're going to go into their 2024 editions, okay? Right now, in April 2024, they're still using the 2023 editions for their tests. But if you are sitting for the CPC, you should be in the 2024 editions already, okay? If you're going with the HEMA, these will be in effect May 1st, all right? So this is what the 2024 editions look like. Your CPT Professional Edition, 2024, this is going to be where your evaluation and management codes are at. This is going to be where all your outpatient procedure codes are at, okay? So anything that happens in the outpatient setting, this is the book that it's in. They have modifiers in here, and there's a lot of good information. I just got done with the video about the tabbing, so that's why you see the tabs. Otherwise, you would see this not tabbed. I will, I will say that. But that's the CPT book. This is the ICD-10-CM. This is the Expert for Physicians. This is from Optum. This is not an ad for Optum, but I love Optum because I believe in medical coders having really good tools to work with. And when it comes to quality, when it comes to just an all-around good book to have, Optum does it every single time. I love Optum. And so because of that, I will always recommend them. This is a wonderful book. Again, it's not tabbed. It doesn't need to be tabbed, guys. None of these books need to be tabbed or written in. It's just people that think it's a good idea to tab, and I just don't think that it is. And I think that when people do that, that it puts too much clutter and kerfuffle on the book, and the book already has a lot. Trust me, it's got a lot going on in it. So with that, you have to be looking at the book, and you have to be able to pay attention, because adding too much other stuff to it is going to make it even more busy than it needs to be, okay? But this is your diagnosis code book. This is going to house every single diagnosis code known to man, okay? And so it's all in here. Your coding guidelines are also in here. And I do recommend that if you are studying on your own, or you're studying for your exam, you need to be reading these coding guidelines in their entirety once per week. If it takes you a little over a week, maybe it takes you 2 weeks to complete a whole run through, that's fine, guys. But the whole thing about it is getting through those guidelines, because we have to be accurate as medical coders. I have always said this: we have to know what doctors know while never having gone to medical school. And the only reason that we need to know that is because we have to understand the disease process. We have to understand symptoms versus definitive diagnosis. We have to understand sequencing. We have to understand different rules, because not every single code is going to apply in every single situation. And sometimes if you have complications of procedures, that's going to be a different thing. If you have a sequela of an injury, that's going to be a different thing. If you have a subsequent visit, or if you have an initial visit for an injury, how do you know which one? The only way you're going to learn this is by reading the coding guidelines. You cannot pay to have this knowledge. You have to gain this knowledge. And the only way you're going to be able to do that is by reading, okay? So this is your diagnosis book, okay? So this is what you need, the 2024 editions. And now again, if you're telling me, Blue, I can't afford 2024 editions, Optum has great deals on their books all the time. But however, I understand, and sometimes you're on a fixed income, you can try to go to your public library and see if they have an ICD-10-CM manual. You may get lucky. If you live in a big city, you may get lucky. Somebody may have donated their coding manuals to the public library. And a lot of people ask me, what do I do with the old ones? You can donate them to the public library. Somebody may be looking for those books and may need them to study with, okay? It's just a great way to start learning, okay? So you can do that with your books, but get these or get a 2023 edition. That's totally fine. However, the 2023 edition is going to have the old coding guidelines. You can go to CMS. If you can Google ICD-10-CM Official Coding Guidelines 2024, that PDF will pop up from CMS, and you can listen to those guidelines. I've explained how to do that before. I'm not going to do it again. But you can also download those guidelines, print them out, and that way you can carry them around with you. So if you have downtime in between, let's just say you're going to go pick the kids up from school and you're waiting in that school pickup line, you could be reading those guidelines. You can be reading those guidelines. You're going to the doctor's office, be reading the guidelines. You are going out and doing other things. You have some downtime in between time, because trust me, everybody has downtime in between time. Everybody does. And don't make excuses. Have it with you so that way you can be reading it, because it's not going to make sense to you. But after a while, when you're taking that test, you're going to know exactly where to go. You're going to know exactly what to do because you have been reading these coding guidelines. It's in your brain. So that's the only way you're going to be able to get a better grasp, understanding of ICD-10-CM. Okay, at least that's just my advice anyway. And then we have our HCPCS Level 2 book. So this is a 2024 edition. Now, a lot of people will ask me, Blue, I don't understand HCPCS. When do we use this? And no one taught me in my school, and they barely did anything about this. Because most times the schools think that if you've learned how to look up codes in ICD-10-CM and you've learned how to look up codes in CPT by going to the index, consulting the index, and then going into the tabular section, that you should have no issue with this book. It is the same setup. It's just a lot smaller, okay? So it does have an index in the front. It's going to give you a list of all of the sometimes they have specific procedure codes, and these procedure codes are going to be insurance carrier specific. Like I will say that Medicare patients, they have the G codes for the colonoscopies, right? They are housed in this HCPCS book. Now you have your high risk colonoscopy and you have your standard screening colonoscopy code, and both of them are in here. There's also HCPCS codes for bandages, for all kinds of durable medical equipment, you know, those foot inserts and, you know, catheters and all kinds of stuff. All of that is in here, okay? And as you progress in your studies of, you know, for medical coding, you will know medications are also in here, right? Those injectables and things, they're all in here, okay? But if you just take the time to go through your HCPCS book, it is very simple and straightforward. Very simple and straightforward. And a lot of times with these products that are like the durable medical equipment, sometimes like the foot inserts, like the insoles for the shoes, if you look on the box, it'll have the HCPCS code. Or if you don't have access to the box that the insert came in, you can always, if the provider documents like the brand name and what it is, you can always Google that and it'll give you the HCPCS code. You're like, what is the HCPCS code for? And then you name the brand and, you know, what it is, and it'll give you a HCPCS code. And then you can just verify. You can look it up back here and verify if that's the correct code. Or you can look around and see if there's a more specific code. Okay, because maybe what is on Google is a couple of years old and maybe there's a new code out. You know, there's a lot of things with HCPCS, but HCPCS is very simple, guys. It is very simple. If you can look up in the diagnosis book or the procedure code book, you can definitely look things up here in the HCPCS book. So it's nothing to be worried about, nothing to be afraid of. You know, that's just what it is, you know, and so. But these are the 3 books that you need if you're studying for outpatient, okay? If you're studying for the outpatient side, these are the 3 books that you're going to be working with. Now, if you are studying for that inpatient side, maybe you want to sit for the CCA or you want to sit for the CCS, the CCS gold standard of medical coding credentials. That is the Mastery Medical Coding Certification. If you want to sit for that and you're studying, okay, you got the CPT book and you got the ICD-10 CM book, you will also need an ICD-10 PCS book. Now, again, this is not the exact book that you need because this is a 2023 book. I just don't have my 2024 book, okay? I haven't ordered it. But this book is basically going to be the same thing, right? So ICD-10 PCS. Now, this is very different from the CPT book and the ICD-10 CM book. Because remember, this is diagnosis, this is outpatient procedures, and your evaluation and management. This is when the patient is staying in the hospital, and this is so that the facility can get paid. Because you know how when you go to the doctor's office, right, you always get multiple bills afterward, right? You get one from the radiologist, you get one from the facility, you get one from the doctor. Well, this is making sure that the facility gets paid. But the setup of this book, this is a procedure book, okay? This is not a diagnosis book. This is a procedure book, ICD-10 PCS. This is a procedure book. The setup of this is a little different, okay? So here is your index, yes, right? But with ICD-10 PCS, and again, this applies if you're taking the CCA or the CCS, you have to build these codes. They're not already built, okay? It's not like ICD-10 CM where you can add on characters and things like that, because, you know, if you have the 7 digits or, you know, 6 digits, 5 digits, 4 digits, whatever. But with CPT, those codes are already made, right? You just can add modifiers to them, okay? With ICD-10 PCS, there are no modifiers. There is no evaluation and management, again, because this is all ensuring that the facility is going to get paid, okay, for the procedures that are performed. So here's the index, and you have to understand that the wording on these procedures is a little bit different. They use words like extirpation and just different things. So their wording is a little different, and you have to understand that. And the guidelines are in the front, of course, just like ICD-10 CM. They are here in the front. It's going to break down like the body part and what it means and the approach and things like that. You do have to go through all of these things in the introduction, so that way you can better understand it. ICD-10 PCS, additional features, right? And then the guidelines for coding and reporting for ICD-10 PCS. And again, you can get these by Googling these as well. And so here's all the guidelines for these. You do have to read these so that you can understand. And here's, of course, your index. But here are your tables in the tabular section. So every single one of these is going to be a different body part, different approach, different device, different qualifier. So sometimes these procedures are going to be done on a diagnostic basis. Sometimes there's going to be no qualifier. It'll say no qualifier, but it'll give you different options. And so you're building the code for ICD-10 PCS. And again, you're going to be doing this if you are working on the inpatient side of the house. Not inpatient as in professional fee, but inpatient as in the facility side, okay? And so these are the procedures that you're going to use when you're coding for those facility charges for the procedures that happen like in-house, you know. So this is your ICD-10 PCS book, and that's what that is. But again, if you are taking the CPC or the CCSP, you do not have to worry about this book. Do not worry about this book, okay? It's going to be these other three, all right? But if you are taking the CCA or the CCS, these are the 3 books, okay? Just imagine this is a 2024 book, okay? But these are the 3 books that you're going to be working with on that exam, okay? The ICD-10 PCS book, of course, the 2024 edition, and then, of course, your ICD-10 CM and your CPT, okay? If you are with AAPC and you're taking, I'm not sure what ones are, I think it's just the ICD-10 CM and ICD-10 PCS code if you're taking the CIC, the Certified Inpatient Coder exam. But just so you know what each of these books are and what they're for, okay? So that's an explanation of those books, those medical coding manuals and what they are for. So the other thing that I want to show you, because this is a show and tell-esque type of show, and let's see here. Okay, So I've talked about these before, about the coding companions. Now, again, not an ad for Optum, but these are from the Optum website. And I kind of want to show you these because if you are already coding in the field and maybe you're kind of struggling on your understanding of the particular specialty, these coding companions are really helpful, okay? Now, orthopedics, these are the 2023 editions. These are still great reference because there's still a lot of very good, useful information in them. However, they do update every year. But if you're still a student trying to learn, you can definitely get older books, okay? This is just to kind of help you to learn. But these coding companions really kind of go over everything. Now, orthopedics has to have the spine and above and the hips and below because otherwise together it would be too big, okay? But they did break it down that way. It does give you some guidance about evaluation and management when it comes to those types of things. And it does give you a really good E&M tool here. Sorry, guys. So it does give you a good E&M tool here for you to look at. It does explain things more for you. But the best part about this book is this, and both of these books, is that it will give you the procedure code, and then it'll break it down, and it'll give you an explanation, and then it'll give you coding tips, okay? And then it'll tell you, it'll give you a list of all the applicable ICD-10-CM codes that go with this procedure code. Then it'll talk about where the CPT assistant is at, right? Where to reference CPT assistant for the AMA. And then you have the RVU and Medicare edits if you need to know that information. And then it'll tell you terms to know: complex repair, debridement, subcutaneous tissue. And it breaks every single procedure down in this section. All these procedure codes. It's going to break them all down for you. And it's going to give you all the same list of all these ICD-10-CM codes. And this is just to kind of help you to understand better. That's why it's called a coding companion. And it's going to give you the CPT codes, you know, just some illustrations if they need to, explanation, coding tips, and all of the applicable diagnostic codes that go with it, and then the AMA references, right? And then your RVUs, and then terms to know. This is a great book. I've used this book before to help my providers to understand. Why am I? Sorry. I have used this book before to help my providers to understand why they can't put certain procedures together, or why certain procedures are picked up versus other procedures, because this explains everything. And so they're like, wow, this is really neat, Blue. Of course, you know, but it goes through the whole section. It goes through everything. So all these procedures that you were ever curious about, and then it has all of the diagnosis codes and everything that goes with it. I mean, it is just a fantastic book altogether to really help you to kind of dive in and understand everything. So these are great to have. I got these, and of course I use them. I still use them even though they're 2023 editions, but it still helps. And because a lot of the codes are still there, if they're not, I still know I can find a reference that'll get me at least close to it, you know, with that. And then, of course, I have one for the emergency department, critical care, and infectious disease. Again, this is a 2023 edition. I got these from Optum when they were on sale. So it's going to do the same thing. It's going to give you the procedure code. It's going to give you an explanation of what it is, and then the coding tips, and then all of the diagnosis codes that go with it. So, and then the RVUs, any kind of AMA guidance, and then terms to know. So, again, these are great as reference and resources to help you better understand. There is nothing better than that light bulb moment where you get it, you know, and you understand. And then having these tools there to help you is just fantastic. I got, of course, the one for podiatry as well. And again, it's just a really great way of getting that sharper knowledge so that you can really understand what's happening. It's very easy to get confused with what's happening in the CPT manual because sometimes it only gives you so much information. But getting those explanations, those layman terms explanations is, again, just a really great resource to have especially if you're in a specialty clinic like that. All right, and then let me show you guys one more thing. So I'm already running out of time. Always when I talk about books, right? Now, this one comes from Decision Health. Yes, it is a 2021 edition, procedures in plain English descriptions. Now, Optum does have that. They do have the ICD-10-CM coder desk reference. They do have that. However, when it comes to this two, I do like the one from Optum. However, I really like this one from Decision Health, okay? And it is really great because literally when they say plain English descriptions, they literally mean plain English descriptions. Why? Because sometimes when we're looking at the CPT manual, right? Okay, which is all these procedures in here, and sometimes the way that they explain it, there's not a lot to it, right? There's not a whole lot to it, and let's just see, like right there, and it's just telling you that. Well, this book will tell you even more about what happens with it, right? So it'll give you, and it's all the procedure codes from CPT, okay? And that's the plain English descriptions procedure book, right? So it'll give you everything. So it'll break down everything, and it'll give you like a whole description of what's happening. And sometimes that's what you need, because when you are going through and you're looking at these procedure codes, and then you're looking at the note and you're like, well, which one do I pick? If you have a book like this plain English descriptions book, oh, that's just going to make it way easier to understand. It really will. Okay. So, I mean, that's what I recommend for any medical coder or any medical coding student. You don't have to have it. Okay, guys, but it does help. Look at all these good explanations. Yes, the writing is very tiny, but I believe that there's like magnifier sheets that you can buy that can make the stuff a little bit bigger for you to be able to like actually look at it and read it. So that's always an option. But yes, it's going to go through everything. And so, I mean, I love it. I really do. I mean, it's all in order and everything. And it's just going to give you just a plain English descriptions about all these procedures to help you better understand the procedure codes. And yes, it's still a 2021 book, but I still use it because even when I'm working with my students and we're trying to understand a procedure code, I will pull this out, and trust me, it makes all the difference in the world versus the very tiny explanation that you get from CPT versus the more thorough description that you get from a book like this of procedures in plain English descriptions. Now, I will say it's a little bit more pricey because I think, do not quote me, but I think it's like $175, something like that for this book. I believe. I haven't looked at it because I try to stay away because I just want to buy books. I love books. You know, look at this, guys. I mean, this isn't even all my books, all right? So, but it's just something that it's a great reference to have if you're already in the clinic, if you're a student and you just want to have more of a better grasp of understanding. You know, get one of these books or get the one from Optum. The Optum Coder Desk reference book, I think, is like it may be $60 something for the 2024 edition. But if you wait towards the end of the year, you can get it for like $20, you know, $20 something. But if you get that right now, because you say, well, Blue, I really need help and I don't understand, and I think that would really help me. It's an investment in yourself, guys. I mean, again, you can always check the public library and see if they have it. You know, hey, if you can find that at the public library, you just found gold. So, but again, this is going to better help you to understand those CPT procedures. Decision Health at codingbooks.com. Now, again, not an ad for them, but they're a little bit more pricey. But again, I feel like it's worth it. I went to a conference and this was a gift from a conference. And so that's, I mean, but I have purchased many books already from Decision Health. So again, this is why I try to stay away from them because you know, they do have really great books there. And I did get one for, which one did I get? Hold on. I did get this book. This is the 2024 edition, so I did pay some money on this one. But this is a orthopedic coding and documentation trainer, again, also from Decision Health. this is a fantastic book because, again, this is breaking down everything that they need to know when they're documenting so that the most specific code can be selected. And there's not going to be any ambiguity, not any question about what happened, because that's what it all comes down to, guys, is that we have to make sure that there is no question about what happened with that patient's encounter. So yes, I did invest in myself to get this book so that way I can help my providers better, because not all these procedures they do all the time. So some of these I didn't even know about. And so again, having this book is very helpful. So, but that's just me, but I do recommend the books that come from codingbooks.com or Decision Health, because again, they are fantastic and they're just really great resources. Optum, again, this is another really great resource. And I hope that this video has helped you. I know this was a lot of books. And again, these other books are just supplemental books. You definitely do not have to get these. But if you are studying medical coding, you do need the manuals, okay? The manuals that I showed you. But again, the orthopedic coding and documentation trainer, and then the procedures in plain English descriptions, these are all, and the coding companions, these are all extra. Do not get these if you say, well, no, I don't get these. Don't feel pressure, okay? But if you do have extra funds and you want to get these, again, it's going to be a great resource for you. But there's also lots of free resources on the web too. So keep that in mind. Anyway, I'm going to go ahead and wrap this one up. So with that said, I hope you all enjoyed this. If this video helped you, please like, subscribe, and share, and I will see you all next time. Bye.